Hi everyone. I'm here with Dr. Jake Covert. How you doing, Doc?
I'm doing good, thank you.
All right, so we're going to talk about components of fitness. And we're specifically going to talk about flexibility. Flexibility is one of the main components of fitness. So, don't skip this. It's really important. I know everyone likes to lift weights. Well, not everyone, but people that are into fitness like to build their muscles and all this. But we're going to ask the doc how this flexibility plays into that. So if you're interested in knowing more about our weight loss program, use the QR code on the screen or the link in the description. And if you're interested in interviews with doctors, nutritionists, and personal trainers, subscribe to the channel. All right, so we have a stretch program in all of our clubs, maybe not Sparks, uh, but talk a little bit about, because you're into lifting weights, you're certified personal training as well as a chiropractor, and you just tried our stretch program for the first time a week or two ago. So tell us about how important flexibility is and how it all ties in to
Mhm,
our health.
mhm. Yeah, no, the stretch, I tried it for the first time 2 weeks ago, and I was very impressed. I've always had a lot of patients pair massage with adjustments and other chiropractic work that I do, but I have to say, with looking at massage and assisted stretch side by side, I am a much bigger fan now actually of the assisted stretch. Massage is great, don't get me wrong. It's great to help the muscles relax, good for recovery, good for blood flow. But for me personally, after massage, the benefits of the massage almost end as soon as the massage is done. Whereas the stretch, I noticed it was 2 weeks ago, and I'm still feeling some of the benefits from just that single stretch that I did. And not to mention they squeezed me in because I was downstairs and I asked if I could just try it out real quick. So it was only about a 20-minute stretch. So despite it being 20 minutes, it was more effective than an hour long massage for me personally. Now, for my older patients, I have also noticed that they have paired stretch with my treatments, and the outcomes are much better. The adjustments are much better. The rehab, everything just moves a lot faster. And I think the biggest component of that is essentially that, I mean, they take you through ranges of motion that number one may be hard for you because you're limited due to pain of actively moving through that range of motion. So once you can passively go through that, your muscles are able to accommodate it because they're not forcing the contraction to try to move through that range of motion. So it's very good to just take your muscles through the full range of motion, allow the muscle to fully contract and relax. It's very healthy. And so for my older patients in particular, I think there's a lot of benefit to taking the time to go through those ranges of motion.
So there's two things I want to talk about, and then I get your feedback on both these two things. First, Gen Z, the younger generation, is really into recovery and letting their body, pushing their body hard and then recovering. So there's science behind some of the things they're doing, the hot and cold plunge pools, hot and cold, different therapies and different things that help for recovery, because recovery is really, really important. So I wanted to get your thoughts on that, how this affects recovery, but also this is a this is an obvious one to me for people who in their later years, for seniors, for people in their 50s, 60s, 70s, 80s and older. Flexibility is going to stabilize your life. And what I mean by that is the more flexible you are, the less likely you are to fall. People fall because they're taking these little steps and they just tip over, right? So if you can just reach out and you're flexible and you can take a wide step and you can move because you're flexible, that's going to keep you more secure in your daily activity. It's less likely that you're going to fall. If you trip, boom, you can catch yourself. Because you're more agile. Why are you more agile? Because you're more flexible. So let me get your thoughts on those two things real quick on the flexibility and the stretch. And you don't have to do assisted stretch. Our assisted stretch is great because they use massage guns and a combination of all kinds of things. But it's important to stretch, and it's most important to stretch after you exercise. And I put at least 5-10 minutes into stretching every time I'm in the gym now. And it's been something that I've been doing for over a year now. And I see the benefit. It's something that is easy to skip. I don't want to stretch. I'm rushed for time. I don't want to work on my flexibility, so I'm just going to go. But those two things, Doc, recovery, which the younger people are into, and older people and their flexibility, which is going to affect their mobility.
Yeah, so I think in terms of a lot of the modalities that people are using for recovery, now for high level athletes, when you look at some of the hot, the cold contrast, some of the red light, a lot of the uh, kind of advanced technologies that people are using in recovery, I think for a general day-to-day gym person, I think just purely resting is gonna be very optimal, more than enough than what you need. When you start getting into some of the nuanced modalities of recovery, I think you're looking at marginal gains at that point, which for high-level athletes is very helpful. Like if you're doing some cold plunges, if you're doing these different assisted programs, they can be very good for high-level athletes. But I think
Well,
at the
let me
end of the
just ask, so younger people
Mhm.
tend to be the athletes. Um, so they're focusing on recovery. So these little things, and like, yeah, I know most people, there's nowhere to do hot and cold plunge pools, but just sitting in a steam room or sitting in a sauna or getting in a whirlpool or a jacuzzi, those are simple things that you're talking about more, right?
Exactly, and yeah, exactly. I don't think
Taking a
you
cold shower.
Yes. Yeah, in other words, you don't need to get fancy with it. I think simply resting, getting in the sauna, doing very simple things like that are gonna be very effective. Now, the biggest thing, again, is consistency. You need to make sure you're consistent with it. If you just get in the sauna one time every quarter, it's not really gonna do a whole lot for you. You need to make sure it's if you get on a regimen, maybe you're going in the sauna 2, 3 times a week for your recovery after your weights. Biggest thing is the consistency with it. So that's going to be a huge component of that. In terms of when you talked about the flexibility with even like as you're getting older, I 100% agree with you on that one. Because if you want to talk about fall prevention or just the ability for you to feel comfortable and moving and being able to get up off the ground, it comes so strength is going to be the biggest aspect of that. You need to lift weights, you need to train. Now, pairing that with some sort of mobility work and program is going to be effective because not only even when you just talk about strengthening a muscle, one of the biggest components is number one, mechanical tension. So the weight that you're lifting, the load that you're lifting. But number two, going through the full range of motion of the muscle. So if you're not going through the full range of motion of the muscle, you're leaving number one, a lot of strength on the table. And number two, a lot of the functionality of that muscle on the table. So it's very important to be able to fully go through the full range of motion of a muscle. And that's why stretching and mobility is so crucial because if you as you're getting older, if you practice your mobility, if you do a little dynamic warm up where you can get, just kicking your legs up in the air, making the muscles do a little quick contraction, bringing the muscles some blood to the muscles before you work out. When you are getting up off the couch and you trip and you're about to fall, your muscles are going to be able to, number one, go through that range of motion, but number two, stabilize because they're going to be used to and trained in those lengths and positions when you're not expecting it. So it is so crucial to train your mobility and your strength for those reasons.
I see our trainers in all of our gyms working with their clients, and a lot of them are older, working on mobility type warm-ups and stuff where they're, sweeping with their hands, and a lot of that stuff, warming up and working on mobility is going to help improve the balance. But you're right, it's about the range of motion. The stretching, which also helps your range of motion, comes after. So I see our trainers really emphasize this stuff with the athletes are doing it for a different reason than the senior citizens are doing it, but it's important for everyone, and it's getting the recognition that it needs to have in the last couple years.
100%. And I think that's also just for everyone else, not even in the Parkway system, but if you do have a personal trainer, I know at Parkway, there's a standard assessment when you bring a new client in where you're simply putting a PVC pipe on your back and you're testing your rotation. We're testing the different ranges of motion. That's just a standard before you even start training with anybody here, which I think is so crucial because it, number one, gives you an understanding of, hey, how limited is my mobility? Number one, but number two is maybe you had some pain at these ranges of motion and you didn't realize that. And these trainers are helping you not only improve your mobility, but they're strengthening you at these end ranges of motion so that you're more comfortable and confident with day-to-day living.
All right. Well, Doc, if people want to reach out to you, you are at the Parkway Athletic Club in South Reno. But if they want to follow you on social media, they want to reach out and find out more about what you do, how do they do that?
Yeah, my social media and website are both atlaschiropractic.us. And then you can also send me an email at info@atlaschiropractic.us.
All right. Thanks for being with us, Doc.
Thanks for having me.